good morning. It's time now to rejoin the Senior Talk, brought to you each week by, well, Dianne, here we go. It's brought to you by the senior living community called Harbor Place, located in Port St. Lucie. And this morning we have a special guest, and Dianne, will you please introduce our guest for us?
Fantastic. Good morning, Paul, and to all our listeners. Some of you may have heard of the sayings, your eyes are the windows to your soul, or the eye is the lamp of the body. Today's show, we will be discussing how the eyes are our window to overall health. Our special guest is Dr. Fier, Eye Care and Surgery Center. Tell us more about you and your specialty, Doctor.
Well, I started my practice in 1980 in Stuart as a single practitioner in a single room, and it's grown tremendously since that time. We have 5 doctors now and 2 locations, one on East Ocean Boulevard in Stuart at 1441 and one on Prima Vista Boulevard in Port St. Lucie at 514. I think I've started my practice with the idea of trying to treat people the way I would expect to be treated in a first-class fashion. So we expect every person to be treated as an honored guest in our office. And my staff is hired with the idea of working with me, not for me, and treating those people as they would expect to be treated. I think that formula has worked very well, but there's a second side to that formula, and that is good results. So the other part of how we treat people is to make sure that we explain to them in detail, in words that they understand, not in medicalese, the various problems that we found, and then the various solutions that we can use to treat their particular problems. No one leaves the room without being asked, do you have any further questions? And I think that those are all very important things, as well as not only getting good results with our medical treatment, but excellent results with our surgical repairs.
Well, tell us about your training and why you became an ophthalmologist.
Well, I actually went to medical school at the University of South Florida in Tampa after graduating undergraduate with degrees in chemistry and psychology from University of Florida. I was in University of South Florida's 3rd medical school class and really interviewed people in their 1st and 2nd medical school class before I decided on that particular school. I went to medical school to become a pediatrician. USF had a world-renowned chairman for their pediatrics department, but in practicing pediatrics, I got very interested in neonatology, taking care of premature babies, and they have a particular disease called RLF, which is a mouthful, retrolental fibroplasia, which is a disease of the back of the eye and the retina that neonates get when they get too much oxygen. So I was running the neonatal intensive care unit, which was the largest in the state at that time at 30 beds. Now it's 130 beds. And in researching a lot of things about this particular disease and becoming expert in that and examining hundreds of babies, I got very involved with the chairman of ophthalmology. And he was extremely dynamic and influential in getting me to turn more towards ophthalmology than to pediatrics. I thought perhaps I'd be a pediatric ophthalmologist, and we certainly did lots of surgery at that time for kids, but it's mainly muscle surgery. However, when I got more into ophthalmology and started doing intraocular surgery, it interested me even more. So I thought that I'd rather do lots of different things, like operate on cataracts and glaucoma and take care of macular degeneration and do plastic surgery of the lids and take care of tumors around the lids, rather than just do muscle surgery for kids. So I did general ophthalmology, but I certainly wasn't afraid of taking care of children. Many ophthalmologists don't like kids in their practice.
Fantastic. As we age, as you know, this is Senior Talk. What are some of those, what can I say, diseases, eye diseases that seniors face? And I know one of them is dry eyes. Can you tell us more about that?
Sure. Dry eyes is obviously not making tears like you used to. And with age, we do make less tears. It's really one of the most underdiagnosed problems in the senior population because it's just ignored. However, there's lots of symptoms of dry eyes, and it can affect your vision, such as itchy, burny, stingy, scratchy eyes that have nothing to do with allergy. And you can also have blurred vision, sometimes intermittent and sometimes permanent changes in your vision because you're just not making enough tears. And there are lots of good treatments for that. First, we have to make sure there are no other associated problems, such as inflammation of the lids or a problem with the tear drainage system in your eye. And then we can offer things like artificial tears or a teardrop that has a medication in it that will allow you to make more tears on a daily basis. And then we actually have a way to change the tear exiting from your eye through small holes in your lids, and we can actually put a little tiny plug in that hole, and what that does is just keep the tears around longer. So those are some of the many things that we can do to help people with dry eyes, and that's only going to become more common if you do a lot of computer work, or if you're under a fan, or and like the computer work, if you're doing a lot of reading, you don't blink as much. So when you don't blink as much, you don't push those tears across your eye, and then you start having those particular symptoms.
Humidity, is that good for dry eyes? Being around humidity and the weather
Yes,
itself?
but you don't have to be in a humidifier in order to be comfortable. But if you're in the wind and outside in the sunshine, things that will evaporate your tears quicker, or if you've had some wine for dinner and then you sit down to read and your eyes are drier from that, it can become effective.
All right, and so we understand with dry eyes, it's environment. It can be environment.
Certainly.
And is it genetics at all?
There are very few genetic causes of dry eyes.
Okay. Another eye disease is macular degeneration. And I have to say, working with seniors, I see this quite often. I also see them driving. Go ahead. Tell us about macular degeneration, and should you drive, and when should you stop driving?
Well, macular degeneration is interesting because when I started my practice in 1980, if people had significant macular degeneration, the only thing I could do really was hold their hand and tell them that I'm sorry, you'll never live in a black world. You'll always have vision around the edges of your vision, and you'll always see light and dark and maybe some objects, but I can never give you your central vision back. And that's changed dramatically over the years. We had laser correction for that, where we try to dry up leaky vessels in the back of the eye. So let me backtrack.
Okay.
Macular degeneration is a disease of the retina in the back of your eye. And it's a breakdown of the various layers of your retina. And you have 12 layers, and the outside layer is the most important, called the RPE. And that can be a slow, steady, dry degenerative process. But in 10 to 15% of those patients, it turns into a wet process, which means your body wants to heal those areas. So it slowly grows vessels into the macula. Unfortunately, those vessels are abnormal, and they tend to leak, and then they tend to bleed. Those leaks and those bleeds turn into scar, and you can't see through a scar. So at first, we try to laser the origin of those leaky vessels, but of course that's right next to your vision, so it would give you a little blind spot, but maybe preserve the center. But sooner or later, those vessels would would go into the center and literally blind you. Now we have injections that we can give you that will try to dry up those vessels, very successful in doing so. And we have 3 different medications to use. That's the good part, and we can bring people back to excellent vision. Unfortunately, you need repeated injections in order to continue to keep those areas dry. And I know it sounds horrible to think that somebody's going to lean you back in a chair and stick a needle in your eye. And I didn't believe it either until I went to the person who was doing these experiments, and watched them do about 30 of these. And with proper numbing medication, a patient doesn't see anything that's going on, and the injection really takes an instant. And most people say, oh, I think I felt something, but it wasn't any pain. And they're very grateful to have their vision back. As far as who can drive and who can't drive, depends on how far your vision has deteriorated. Driving is two parts. One is how well you see, how clearly you see, and then how much of the visual field you actually see in front of you. So there are certain minimum requirements in order to drive, and when those are not met, then it's my obligation to at least tell the patient that in my estimation they don't have the visual acuity or the visual field to drive safely.
All right, I'm trying to give a visual to our listeners who may think they may have a macular degeneration or may not. So if there's a red car in front of me, and I just in the beginning stages of macular degenerations, what would I see?
Well, you still see that red car.
Will I see details?
Usually the symptoms you have are a slow deterioration in your acuity, how well you see things. It might also be a distorted vision. If you look at a straight light pole and all of a sudden there's a bend in it, you know there's not a bend in it.
Right. Or
if you're reading something and the letters don't look like they're supposed to look and they look distorted, well, that might mean that you have some deterioration in the macula, and that should be looked at. Because the sooner we treat you, the better off your results are in the end. So it's really just changes in your central vision that would bring you to the office.
And it causes blindness if untreated?
Absolutely. It can cause blindness. And again, the sooner we know, the better it is. So it's either a decrease or distortion in your vision. Now, I told you it's usually a gradual thing, but if you had a bleed in the back of your eye and you didn't know you had early signs of macular degeneration, it could be a sudden loss of vision. There are other things that can cause that, but of course, macular degeneration is very common in causing that.
All right, cataracts.
Well, before I get off of macular degeneration, in the next 5 years, our population will have probably 3 times as much macular degeneration as we have now because of our aging population. So again, it's very important to not only monitor your vision, but to perhaps do things that might slow or prevent those things from happening. You can't prevent aging, but it's been shown that if you take a multivitamin, that you might slow down not only the aging process, but the aging process of your macular degeneration. When you go out in the sun, it would be a good idea to use UV protection, because that's another thing that's associated with macular degeneration. Alcohol and smoking are horrible for macular degeneration. So you've heard those words before. As far as cataracts, when I started my practice, the national average for cataract surgery in a year was probably about 300,000 cataracts per year. Now it's more like 2 million cases a year, again, because of our aging population. What can you do to prevent? Well, most cataracts are due to aging. Some are traumatic. Some occur because of inflammations of the eye. But far and away, the most common reason is your eye gets older. And as your eye gets older, the lens in your eye, which sits right behind your pupil, the proteins in that lens start to break down, and therefore it's not clear, but it's cloudy. Even though we're doing 2 million surgeries a year with excellent results, in the next 5 years that will double or triple as well as our population ages.
And it also can be due from, just like macular, is the exposure to sunlight as well.
UV is certainly associated with cataracts, and so is smoking.
And drinking.
And so is diabetes.
I've got a question for you, Doctor. Is there a particular age one should not expect, but would typically see cataract problems? Because I've had both my eyes done. One I did at late 50s, I think it was, and the other one, and the changes in the surgery were incredible between one and the other.
There are some rare cases you can even be born with cataracts. However, most of the cataracts with aging start in your 50s. And just because it's starting doesn't mean you need your cataract removed. The cataract has to affect your vision. It has to decrease what you want to do with the things in your life, whether it be driving or reading or whatever your hobbies are, before your vision needs to be improved with cataract surgery. Many times, if you have an early cataract, it just be corrected with glasses. But when we can't give you glasses to make your vision better and you're suffering in your daily life's activities, that's the time for cataract surgery. So it may start in your 50s, and then certainly it gets more and more common in 60s and 70s. There are many patients that we follow in the office that have cataracts but don't need surgery. So we follow them from year to year and also tell them if there's a time in between your exams that your vision has noticeably gotten worse, then you need to see us for that. Cataract surgery, fortunately, is one of the most successful procedures performed in the United States. We've taken it from an inpatient surgery done under general anesthesia, taking a couple of hours to do, to an outpatient procedure, which is done under local anesthetic. We'll give you something to make you calm, cool, and collected, and maybe a little sleepy. And we use anesthetic on the surface of your eye. You don't feel anything during the surgery. And your surgery can be finished in probably around 10 minutes. The success rate in our office is 99.9%. And I stopped counting over 30,000 surgeries in my career and have a lot of gratification from the success rate.
We have a phone call now for the doctor. Just 1 second, please. Go ahead, caller.
Yes, please.
Good morning.
Good morning.
Comment and a question. I've had the cataract surgery done in the past, quite a few years ago, and actually the doctor made a video of it while they were doing the operation, and we were speaking and everything. They don't knock you out or anything. They just numb the eye. My question was, in relation to having the cataract surgery, does that eliminate you from having anything done in the future? Like, you can't do LASIK once they implant that new lens. Is that new lens replaceable, or is that, as your vision changes, can you go in and get another new lens, or can anything be done to that?
There have been a lot of changes in the implant that gets put in after cataract surgery. I remember when we didn't put any implants in and we just gave people big, thick glasses like George Burns used to wear a long time ago. But fortunately, implant surgery has come a long way. We used to put an implant in that would just correct for your distance vision. However, those were done with really guesstimates of what power implant you would need, because everybody needs a slightly different power depending on the curve and the length of your eye. Now, statistically, we have much better formulas to figure out what power to put in your eye. And not only can we correct nearsightedness and farsightedness, but we can correct for astigmatism. The implant in your eye can also have one that it corrects for astigmatism. And now we even have implants that will give you both distance, intermediate, and near vision, called a multifocal implant, so that perhaps you may not need any glasses for any range of vision. If your implant is put in your eye and your vision is not as you would want it without glasses, then certainly glasses is one way to treat. You still can have a LASIK procedure on your cornea if necessary to improve your vision. Having cataract surgery doesn't keep you from having that particular surgery. You wouldn't want to have
I have the bifocal for reading because my distance is good because of the lens they put in there.
Yes, sir.
That's changed some over the years. Naturally, it's going to change anyway. But the bifocal, I use the bifocal for the glasses for reading.
Correct. And that's what a lot of people do who are corrected for distance vision. You wouldn't want to take your implant out and put a different one in because really your body kind of scars it in place. So it would be a difficult procedure. However, on the horizon is a new procedure which would require making a tiny incision in the cornea, that's that clear part on the surface of your eye, a tiny pocket, and slipping in a small gel substance, which looks just like your cornea, and that will help you see far away as well as close up. It's not FDA approved in the United States now. They are doing experiments on people here with excellent success. In Europe, they are doing them monocularly, meaning in your non-dominant eye. And some people, because of this success, are even putting that in both eyes. But the FDA requires 2 years of human experience before being approved here in the United States. And that's called a teardrop.
Okay, doctor, thank you so much. Thank you, caller, for that phone call. So,
Fantastic. Doctor, while we're going to be coming into a commercial real quick here in the news break, can you tell me again about your locations, your contact information for us?
Well, we are on the web, Fier Eye Care and Surgery Center. One of my physicians is Dr. Scythe, Richard Scythe, and he is a board-certified ophthalmologist who does lots and lots of cataract surgery, does comprehensive examinations, follows people with macular degeneration, dry eyes, etc. And one of his special attributes is he's been doing glaucoma surgery to correct for people who have glaucoma who don't respond to drops and don't respond to laser therapy, which also he performs, but also require a surgical procedure on the eye called a trabeculectomy with tube placement, and he's become quite astute at that particular treatment for that disease. We have Dr. Chris Fry, who's an optometrist in our area, has been with me about 15 years. He also does comprehensive examinations and follows people for various problems. He's really gotten into dry eye treatment and the various ways we can treat.
Fantastic. Your telephone number in Port St. Lucie, the office is?
772-878-3437. And in Stewart, it's 772-286-0007.
Fantastic. Well, Paul, we'll go into is it a news break?
We got about a minute. We got about a minute here.
We got a minute.
I'll tell you about Dr. Palmer, who's our newest associate. Been with us about 1.5 years, 2 years. And she's also a fellowship-trained cornea and external disease specialist. So she's the only person in 2 counties that's permanent, that does corneal transplants in the new way. And she also does LASIK and plastic surgery of the eyes.
Fantastic. Stay tuned.
Okay, doctor, thank you so much. An excellent program so far. We'll be going now to the news at the bottom of the hour. This is WPSL 90, Port St. Lucie. Temperature right now is 75 degrees. We'll be back in just about 4 minutes, so stay tuned for the news. And good morning once again. It's time to return to the Senior Talk program, brought to you every week this time by Harbor Place, a senior living community in Port St. Lucie. This morning, Dianne McDonough, who's the director of sales down there, is joined by guest Dr. Fier, who's the ophthalmologist, and I'll turn it back to Dianne and the doctor, and they can continue with an excellent show so far. Dianne?
Doctor, tell us more about your team.
One of the doctors I didn't get to mention before break was Dr. Kevin Kelly, who's become instrumental in our office and is certainly an asset because he's our retina specialist. And he is a fellowship-trained retina specialist. He is the one who administers all those injections to people who have wet, age-related macular degeneration. But he's certainly well-trained in doing surgical procedures on the eye, and I believe was the first person in Florida to operate on macular holes in the state. So he's an easy person to know, very personable, but also very bright, and easily communicates with patients what their problems are and realistically what to expect with his treatment.
Before the show, you and I were speaking about how seniors, when they walk into a doctor's office, how they want it to be like it used to be, the small town doctor, by talking to them, looking at them in the eye, and not looking at their computer. Any thoughts on that?
Yes. Part of the team that I didn't talk about yet, and they are extremely important, are our front office team and our ophthalmic technicians. We want everybody to feel at ease. People are afraid of losing their vision more than they are of getting cancer or getting AIDS, and nobody wants to go blind. So from the first phone call to the moment you leave, we are going to treat you as our guest, as our special guest. And everybody is in tune to explain to patients what's going on and why they're doing the things they're doing, and then help them with anything they may not understand. So that's a very important part of our staff as well as the physicians. We want everybody to feel comfortable, and again, we want them to understand in their own language what's going on. We don't want anybody going home and being asked, well, what did the doctor tell you? And they go, I don't know. So that should never happen where we are.
Fantastic. Tell me about a testimonial story of a patient.
Well, of course, there are many concerning thousands of surgeries I've done. I know of one particular patient who was blind in both eyes from cataracts, ended up doing his cataract surgery, and because of his newfound vision and ability to drive, he ended up working for Meals on Wheels, and that was his way of giving back. So he could deliver food to people who couldn't get out of their homes. That's one. I had a lady in her 80s and also took care of her in her 90s, and she was an artist, and her last thing that she was doing was she was painting china, and she couldn't see the colors anymore. But by giving her cataract surgery, she could see the colors very vividly, because one of the things you lose with cataract surgery is the ability to distinguish colors and grades of colors. I also remember a lady who came in, and again, speaking of colors, she thought she was putting eyebrow pencil on her eyebrows, but indeed was putting lipstick on her eyebrows, which wasn't the right thing to do. And afterwards, of course, she was embarrassed, but I'm glad that she had something done to help her on her way.
Great stories. Let's go back to eye diseases, glaucoma. They say, I've heard it been called sneak thief of vision.
Glaucoma, again, is something that's most common. I would say you can be born with glaucoma, although that's rare. You can have family histories for glaucoma, which is important to look at over time. But mainly in your 30s and 40s, you might have a 7% chance of having glaucoma. By the time you reach your 60s, you have a 10% chance of having glaucoma. So the older you are, the more likely you are to have some form of glaucoma. Glaucoma is not something that affects the center of your vision until it's extremely bad. So it's called the sneak thief of vision because you can have excellent vision down the middle, but you could be missing your peripheral vision. And an increase in pressure in your eye, when it's slow, it doesn't cause any pain whatsoever. So you can be having progressive damage and not know it. The only way that you'll know if you have glaucoma is to get a comprehensive eye exam. That doesn't mean going to somebody and getting your glasses prescription. It means having a very careful look at the front of your eye, having a look at the pressure of your eye, and then looking in the back of your eye at your optic nerve, best seen when your eyes are dilated. Dilation does take some time, but it is certainly worth the effort. There are a number of other tests that we can perform in our office to determine if you have glaucoma and when to treat. But again, it takes a comprehensive examination to do so. Once glaucoma is found, well, let's talk about the contributing factors towards glaucoma. I already alluded to family history, and then we have to come back to glaucoma is more common in people who have diabetes and who smoke, and and then we have to talk about we already talked about the family history. Once that's found, what are the treatments of glaucoma? Well, many times that can be treated just by putting an eye drop in your eye. When I started my training, we had to put drops in 4 times a day and sometimes more, and they were painful, stingy drops. But now we have drops that maybe only can be used once a day and still perform as good or better than the last drops that we had way before then. If drops are not effective, we can use laser. There's a laser that we can use in the office that takes about 5 minutes. It's painless. There's no incision in your eye. You feel no pain. And it's about 80 to 85% successful in lowering your pressure. Some patients can either come off of their drops or just are controlled on the drops they had before where they were losing control. If that's still not successful, there is a laser that we can use inside of your eye during cataract surgery. We can actually watch the area that's being treated with a tiny camera that goes through a pinhole incision. Again, painless to the patient, takes 5 or 10 minutes, but has excellent results. If those still aren't successful, then I talked earlier about something called a trabeculectomy, which is actually making a little trap door on the surface of your eye, which is covered by some tissue, and it allows fluid to percolate from the inside to the outside, and therefore lowering your pressure. So those are the main treatments that we have to our availability.
Is glaucoma curable?
We call it controllable. There's a rare form of glaucoma called narrow angle acute glaucoma, which is a sudden increase in pressure in your eye. And when the pressure is normally around 20 and it goes to 60, that is a very painful time. It happens very quickly. That can be solved easily with what's called a laser iridectomy, which is putting a little tiny pinhole in the iris without actually making an incision in your eye, and it happens painlessly. But most glaucomas are chronic open-angle glaucoma. So we can try to slow the progression or maybe even stop the progression of your glaucoma. But once you're diagnosed with glaucoma, you should always consider yourself a glaucoma patient and, of course, alert your family members so that they can go in and get screened routinely as well.
Blood pressure, it's my understanding, has a lot to do with your vision in glaucoma, with the optic nerve.
Well, if you have high blood pressure, it mainly has an effect on the retina. You can have retinal hemorrhaging from high blood pressure. You can have strokes, not only in your brain, but in your eye. Your eye is actually the first vessel that comes off of the artery that supplies your brain, and that can blind you. So that's where it mainly comes into play. There are different strokes, and we can try to help those people with those particular strokes to their eye. Blood pressure is very important to be controlled in people who have diabetes. Diabetes certainly affects the retina as well. I told you it's more common associated with glaucoma and common associated with cataracts. But diabetes is also a leading cause of decreased vision in patients. So they have to control their diabetes by controlling their sugar and taking their medicine the way they're supposed to. Of course, we're going to talk about diet, exercise, decreasing alcohol intake, and last but not least, don't ever smoke. Diabetics have a couple of different problems with their eyes in the retina, which is in the back of the eye. That's like the film in your camera. And again, diabetes can cause little bleedings from vessels in the back of the eye, and also can cause leakages of fluid, like the fluid under under your skin that supports the lymph system in your body. Those fluids can affect your retina so that it doesn't see well. Abnormal vessels can also grow in your retina from diabetes. Those kinds of things used to require laser therapy of the retina. However, many times now we can treat it with the same kinds of medicines that we're treating with macular degeneration, which is an injection, to make those vessels shrivel up and go away. Nevertheless, if you have diabetes, even if you don't show any signs of it in your retina and have a great exam, you should be seen at least on a yearly basis to make sure you're not developing it. Once you've developed it, of course, you'll be seen on a routine and regular basis with your ophthalmologist.
It's interesting how we don't really think about it as we're younger, how our health and what we're doing is going to affect our eyes. We know it might make us overweight, it might affect our heart, but we don't realize what it does to our eyes.
Question for you, doctor. A couple questions, I guess. How often should you see your eye doctor, number one, and that's an ophthalmologist, obviously. Second one is it important to wear sunglasses in Florida?
Well, early on in your life, when you're a little kid, if your parents recognize any decrease in vision or crossing of your eyes or eyes going out or inability to read things at a distance, well, you should be checked right away. In your 20s and 30s and maybe even to your 40s, at least an exam every 5 years should be performed. But I told you the increasing amount of glaucoma as you get older. So in your 30s and 40s, 5 to 7%. In your 60s, 10%. So the American Academy of Ophthalmology says if you're 60 or over, you should be having a comprehensive eye examination at least on a yearly basis.
And if your parents or one of your parents had glaucoma, and should you see a doctor earlier?
Yes, you should probably start seeing a doctor for glaucoma maybe in your 20s, and then routinely after that, depending on what you show at that particular exam. But because it's silent and you have a family history, you need to be seen more often.
Sunglasses, like I said before, it's a question because I've often seen guys not wear glasses playing golf, for example, and I've been told you should keep the sun out of your eyes.
Yeah. There's a close association between UV light and cataracts and UV light and macular degeneration. Most sunglasses come with UV protection now, so why not? It won't hurt you, and it might help you in the long run, and that's my answer for that.
Dr. Fier, it's my understanding that you were the first in Martin County and St. Lucie County to perform LASIK surgery.
It happened quite a while ago, but yes, I was the first person to perform laser surgery for near vision correction and distance. In other words, nearsightedness and farsightedness. Interesting enough, although we got the first machine to do that, I believe, in the country, that never got used because they dropped it off the truck when they were bringing it to our center. So we had to send it back for the second machine. But yes, we've been doing that for quite some time. I don't actively see patients on a one-on-one basis anymore. However, Dr. Palmer does. And so she does all the LASIK surgery. And now we are the only ophthalmic group or ophthalmologists in these 2 counties and maybe, well, counting Okeechobee, 3 counties that have our own laser vision correction instruments in the county. So you don't have to go to Vero and you don't have to go to West Palm Beach to have a LASIK. You can do it right here and therefore save yourself a lot of time and aggravation and money.
If you've had cataract surgery, can you still have LASIK?
You can still have LASIK if you had some unresolved nearsightedness or farsightedness after your cataract surgery. Again, that becomes less and less because the formulas we use have become much more accurate and the implants have become much more elegant and much more accurate as well. But there are some times that there are people who are outliers, and when so, we can treat it with that.
Just one more quick question, Diane, if you don't mind. When you have both eyes done, now my brother had his done, I said, now Billy, make sure you get one eye that you can read with, one eye you see long with, and he chose to go both the same, I guess. Do doctors typically advise you to get one eye so you can read and the other eye so you can drive and they adjust in time?
Most people elect to get both eyes for distance. Okay. However, contact lenses for decades have been using what's called monovision, which is one eye for distance, one eye for near. Normally the non-dominant eye is the one used for reading. In our practice, if you've done that, or if you like to try that, we can try that with you. And if that's something that you like, it certainly is a compromise because one eye doesn't see as well. But it's a very nice compromise because when you have both eyes open, you rarely realize that one's for distance and one's for near. But it beats carrying around your reading glasses, which you always lose, And now the other compromise is a multifocal implant. So you get the implant in your eye that sees both far away, in between, and up close. And
Dr. Fier, it's my understanding Ocean Med Spa is a new line of business that you have created.
Correct. Over the last year, we've created a med spa in Stewart on East Ocean Boulevard at 950. And it does a lot of neat things painlessly. We have a machine, a laser that will remove hair from your body painlessly, any hair. We have another laser that helps to resurface your skin, like if you want a facial, rather than getting glycolic acid or salicylic acid. This is even a better way to tone your skin. It removes brown spots and white spots and irregularities in your skin. It removes fine wrinkles from your skin. It removes spider vessels from your skin and blotching. Women don't like to have blotching of their, not only of their face, but their chest and their hands, the back of their hands. We have a laser, which we were the first ones to introduce in these 3 counties, called Sculpture. And what Sculpture does is it removes 25% of your fat pad in 25 minutes of treatment, and there's a little discomfort but not pain involved. So, and that's the first one like this that's been FDA approved. Most recently, we have a CO2 laser, which is called a Fraxel CO2 laser. And that's for handling very deep creases and lines in your face, as well as resurfacing the face. All the lasers I mentioned up until the time I said CO2 require no downtime. It means you come in, you have the laser, and you go play golf or tennis right afterwards or go back to work. The CO2 is a little deeper and therefore requires some downtime in order to get healed.
Where is this day med spa located?
On East Ocean Boulevard at, I said 950, but it's actually 9:15. Maybe it's too early in the morning for him. 9:15 East Ocean Boulevard in Stewart.
And the telephone number?
Is 219-4552, and we offer very educated people who will answer the phone and take care of you. We offer free consultations for anybody who's interested in having that. We also offer Botox injections, Juvederm, Kybella, Voluma. Those are all injections to help you with bringing some youthfulness to your face. And that's Dr. Palmer, who would perform all those and does it very well and is very experienced in that area.
And for you folks who will later watch this on YouTube under WPSL TV, you'll notice the doctor just read that very, very fine print without glasses on. Doctor, tell us about that. Your eyes must be good for reading real small type.
I'm getting younger, no. In actuality, I am very nearsighted. My corneas were too thin to do LASIK on, so I elected to continue to use contact lenses, but I actually have a bifocal contact lens in either eye. Used to have monovision like we talked about before, but now I have bifocal contacts, and that helps me see close up as well as far away.
And there's your answer. Go ahead, Dianne.
Well, I always say part of living is giving. How do you give back?
Well, there's lots of different community projects that that I support, such as American Diabetes Association, Heart Association, Lung Association. In our office, we have ways of giving back because I have an open policy with all the high schools in the area that if they have students that are interested in medicine or science, they can follow us around not only in the rooms with patients, but also in the operating room and look through the microscope and see what we're doing. I'm also on the faculty of FSU because they have a medical school and they have a branch down here, and for those medical students who want to pursue ophthalmology, they can certainly do it in our office. Dr. Fry has a great program with Montreal. There's an optometry school up there, and in their last year of training, we get anywhere from 1 to 4 students coming down to train clinically of what they've been learning about all this time in optometry. We also have a retired ophthalmologist in West Palm Beach who started a program at Palm Beach State College in ophthalmic technician. And to become a certified ophthalmic technician, there's a 2-year course that he administers, and we are the clinical side of that, meaning those students can come to our office for a quarter, and that quarter of year they spend with us actually examining and taking care of patients with us and learning.
Well, some human interest about you, Dr. Fier. You love dogs.
Yes, I have now 3 rescue dogs. Unfortunately, one was stolen last week and required a whole week of my attention, but he's back at home with his other members, and he's happy as a lark to be there. So I'm involved in the Humane Society here and also support what I say by having these dogs, and they're wonderful to take care of because they give you a lot of love back unconditionally.
This is true. As we know, Arnold Palmer has passed away. How did you know Arnold Palmer? How did you know Mr. Palmer?
Oh,
The golfer, the professional.
I actually didn't meet Arnold Palmer, but we were talking earlier about Jack Nicklaus. And when I was in college, I had a job with Deep Rock Water Company down in West Palm Beach. And my job was just to give away water coolers, and then the salesman would come by later and see if they wanted to rent it or buy it for their office. And I got into Jack Nicklaus's office, and I gave him my whole spiel. I really did, him and his secretary. But he said, "Look, it's just the 2 of us. I don't think we need that something, but thank you very much, boy."
Well, you've worked yourself in the professional field, from selling something to Jack Nicklaus to being in our community since 1980. We thank you, Dr. Fier, for being on the show.
Well, you're very welcome.
Could you tell us again the contact information and your locations?
Contact information is Fier Eye Care and Surgery Center in Stewart at 1441 East Ocean Boulevard, 772-286-0007. And we have an office on Prima Vista Boulevard, which is the same as St. Lucie West Boulevard. It's just 1 mile east of the Turnpike. And that's at 514 Prima Vista Boulevard. And that phone number is 772-878-3437.
Again, thank you for being on the show, Dr. Fier. Harbor Place is an independent living and assisted living. We also are privileged to have Life Care of America on site, making us a continuum of care for seniors. Our telephone number is 337-4330. Please call if you'd like a tour. I'd love to give that to you. Just ask for Dianne McDonough. We are celebrating 15 years in business, and we are proud to serve you and the seniors. Thank you, Paul.
Well, thank you, Diane. An excellent show. Dr. Fier, thank you so much. It was a very enlightening program because all of us here either have or will need that kind of support down the road, I'm sure. You've been listening to Senior Talk, a show brought to you by Harbor Place each Monday morning. And right now it's about 10:59:30, which means 30 seconds from now we'll be going to CBS News. The temperature right now is out there about 74 degrees. Very nice day with a high nearing 88, so we're getting out of the 90s, which is also very nice. And we'll be back again next Monday, same time. I'm sure Diane will tell us who we're having by then, but I'm sure it'll be another excellent program. So we invite you to stop by and give us a good listen. We're WPSL 1590 Port St.